Hi, I'm Dr. Kurt Moody and I'm the Head of Professional Education here at Johnson & Johnson Vision. And today I'm going to summarize the 3 critical steps to fitting a Johnson & Johnson multifocal. And we're fortunate to have a patient here with us today. So Julie is a 48-year-old female who's been wearing one-day ACUVUE TruEye for a good number of years. Her most recent optometrist has slightly reduced her distance correction by +1/4, but Julie has now found that she also needs to wear a pair of +1 1/4 readers. So she's reached out to us to see if we could come up with a better alternative for her. So I'll take you through the 3 steps over the next 5 or 10 minutes in regards to how we should be fitting these lenses. So step 1 is doing a good subjective refraction, and I've already done that with Julie. Some key points, though, are the fact that we should be doing this refraction in ambient lighting, as you see in the room right now. I also always like to do a red-green balance and a binocular balance. These are, in my opinion, the gold standard of doing a good subjective refraction, and it's not anything that's unique to doing a multifocal lens. Whether it's a single vision lens, a toric, or a multifocal, those are all the critical steps to giving us a good endpoint in regards to our subjective refraction. Once we get that subjective refraction, our next step is going forward to do and to determine what our dominant eye is. So there's 2 ways we could determine eye dominance. There's the sensory method and the sighting method. And today we're going to go over the sensory method. Why do we want to go over the sensory method? Because it's a system that's replicating very often what we are doing when we're fitting multifocal lenses. In other words, we're creating a small amount of disparity in one eye, and this is going to simulate very often what we need to do with a multifocal lens. So in just a second, we're going to bring Julie in, and I'll demonstrate that sensory method for you. Okay, so to do the sensory dominance, the way I like to do it, just because it's nice and quick and easy to do, because I already have my patient behind the phoropter. So what do? I show Julie the 20/25 or the 20/30 line, and I say to Julie, I'm going to put a lens in front of each eye individually. It's going to make things a little blurry, Julie, but what I'm going to ask you to do is to tell me when you feel most comfortable. So the way I'm going to do it is I'm going to introduce my refracting lens, because it's really quick. So Julie, looking out there, do you prefer number 1? Or do you prefer number 2?
Number 2.
Okay, let me show it to you again. Number 1.
Mm-hmm.
Number 2.
Number 2.
Okay, so what I just found out is Julie feels most comfortable when the refracting lens is in front of her left eye. So that tells me that her dominant eye is her right eye. So we're ready to go to step 3, which is determining the functional add. So before I put Julie behind the phoropter, I already measured the distance that she comfortably likes to read. And that's really important when we're talking about functional add, because we want to make sure this add is going to be representative of the things that Julie does day in and day out. So in Julie's case, I already measured that at 16 inches, and I've got my near point rod set at 16 inches. And I'm going to start to add plus to my distance subjective refraction until Julie can see that 20/20, 20/25 line. So Julie, like I said, looking at that 20/20 line that we picked out already, I'm going to start to add some lenses. And if you don't mind telling me when it feels nice and comfortable.
Oh, I can try that one.
Okay.
OHZBK.
A little better?
ORZBK.
Mm-hmm. Even better?
Oh, yeah, that's better.
Great. And if I do this, better or worse?
Will you do it again?
Mm-hmm. Or about the same?
They're about the same.
Okay, great. So I don't want to over plus her, because that is one of the things that whenever we're dealing with a multifocal, having an add much higher than what is the normal add can sometimes get us in trouble. All right, Julie, let me pull all this away, and we actually have all the data we need to be able to go on to giving you your first set of multifocal contacts.
Yay!
So we have everything we need now. And I think one of the things that you may have seen is that this probably added about 2 minutes onto what would be a normal refraction we would do for any other soft contact lens fit. So fitting a Johnson & Johnson multifocal is really a pretty quick and easy process. So I've got Julie's spherical refraction. We've determined her functional add. We know her dominant eye. So the data that we've got before me right now is we're a -3 in the right eye, a -4.25, -50 axis 20 in the left eye. Her add's a +1, so it is a little on the lower side than what we would normally consider. But again, that's really the importance of determining that functional add, and her right eye is the dominant eye. So a few ways we could proceed. I can use a typical paper guide, or I could use the digital tool that we have from Johnson & Johnson. Personally, I like the digital tool because some of the things that it does is it helps prevent some very common errors. A lot of times we forget to determine the spherical equivalent, and sometimes we forget to compensate for the vertex distance. The digital tool does all of that for us. So based on the data that we've got with Julie, I know that I'm going to put a -3 low in her right eye, and we're going to put a -4.25 low in the left eye. So I'm going to go out into our inventory room, bring those lenses in, let her put her lenses in, and see how she does. So what we're going to do now is walk through the Johnson & Johnson multifocal calculator that resides on Johnson & Johnson Vision Pro. So as you see on my screen right now, I am logged into my account on Johnson & Johnson Vision Pro. And the easiest way to get to the calculators is, if I bring my mouse up to the business center, you'll see a banner that comes up. And all the way to the right on the banner is the term calculators and tools. So let's go there. And the two calculators that we currently have on this site are sitting here. So we've got the multifocal fitter on the left and the astigmatism fitting calculator on the right. So let's go to the multifocal calculator. The nice thing I like about this site is the fact that not only do we have the calculator here, but we also have a few videos that you could watch, very short, succinct videos that will walk you through how to do a Humphreys binocular over refraction and how to do our sensory dominance test. So again, if you need a little primer on those, quick, easy videos that you could watch in that regard. But let's go to our patient Julie now and input her data. So as you recall, in her right eye, she was a -3 sphere. So I will click that in. Her left eye was a -4.25, -50, and she was an axis 20 in this eye. There we go. She is also 48 years of age, and her add was a +1. Her right eye is the dominant eye. So we've now input all the data, and once I push calculate, we will get our results. The nice thing that we've got with these calculators, as I mentioned in regard to the calculator that we had on the phone, was the fact that it will calculate the spherical equivalent, which will be, of course, relevant here for our left eye. And it will also take into consideration vertex distance. And again, that will be relevant in regards to our left eye because we're above a -4. The other nice feature that we have with this calculator is if I put an add in that's much higher than the age norm, it will give us a warning that the add is higher than the age norm, and that could affect our distance vision. You could still calculate the result, but it is giving you that warning. In this particular case, everything is within normal age realm. So let's push the calculate and see what we get. So you'll see that the initial trial pair recommendation is a -3 low for the right eye, a -4.25 low for the left eye. It will also allow you to see what would be the suggestion if you need better distance vision. And in this case, we would go from the -3 low to a -3 moist sphere. If we needed better near vision, again, according to our fit system, what we would do is go to our non-dominant eye, which in this case was our left eye, and this was the -4¼ low. We would add +1/4 to that left non-dominant eye. So the result is a -4 low. So you could see with this one tool, not only do you get the recommended initial pair, but you also see the 2 suggestions for better distance and better near if needed. We've got those additional tools that will show you how to do a sensory dominance test, how to do a Humphreys over refraction. So quite a lot of tools sitting here at your disposal. And really the end result is simply to make you more efficient and to get to that ideal pair much faster, thus really reducing your chair time. All right, so Julie now has her first pair of moist multifocals in each eye. We've got the -3 low in the right eye, the -4¼ low in the left eye. So initially, what do you think, Julie? How's the comfort?
The comfort's great, and I mean, my distance seems good.
Okay,
I mean, I think it's good.
Great. So what I'm going to ask you to do is I'm going to ask you, let's give these about 10 minutes to settle in. And ideally, the best way to do that is go out into the waiting room. Really encourage you to take a look at your cell phone and look at some of your emails, some of the things that typically you have to put your readers on for. Evaluate them on your phone, but look out the window, see what some of the road signs are across the street. Take a look through my optical dispensary, because one of the things I think that'll benefit, I suggest to all my patients is we definitely should have a good pair of backup glasses. So take a look at some frames. My optician will work with you a little bit later on in regards to what could be a good pair of progressive bifocals, because there will probably be times when you like to use your progressives and times that you'll be using your multifocals. And then I'm going to ask you to come in and just give me an assessment on what you think.
Okay, sounds good.
Great.
Thanks.
Hi, Julie. It's Dr. Moody. Thanks for taking my call.
Hey, Dr. Moody, how are you doing?
Very good. More importantly, how are your contacts doing?
They're doing so well. I'm really excited to talk to you, actually, because they're really working for me. I'll tell you, on the first 2 days, I did notice a difference, like driving home from your office, reading street signs were not as clear. And on my run the next morning, I kind of noticed I couldn't quite see the people coming at me, like exactly who they were, till they were much closer to me. So I have a little bit of a distance, it's a little bit worse. But first of all, I haven't noticed that since those first 2 days, and I have been running and I have been driving around. And so I think it just took me a second to get used to it. And then second of all, the near is fantastic. Like, I can be on Zoom calls. I can read the screen. I haven't had to say, can you please make that bigger?
Good.
Even when I'm typing emails, everything seems to be working for me.
Good. And everything you just described, a little bit of adaptation is perfectly normal. And the fact that we would notice just a slight reduction in that distance vision compared to how you are with your true eye is absolutely expected. I mean, one of the things to keep in mind, Julie, is I know you still have some of the true eye left, is, you could mix and match if you find that that's an opportunity for you. Meaning, where your true eyes at time.
Yeah, well, in fact, that's exactly what I did this past weekend, since I'm not working on my computer, and I only had those 10 sample lenses you provided to me. So I decided to wear my true eye over the weekend because I wanted to save my sample lenses for during the work week when I really need them.
Good. So you're able to see the computer. Are you able to also see some of the labels and things that you had mentioned?
Oh, yeah. It's funny I didn't even mention that, because I didn't even think about it, because I did just order something from Amazon, a new device. I had to read the instructions, and I could see them fine. Normally I'd have to pull out my readers and turn the lights on bright because if it's late at night, and I'm finally doing that. So yeah, I guess I can read the labels as well. So I'm really happy there's a solution for me. Good.
So it does sound like we're on track. I know we have you scheduled to come in just to check the physical fit of the lenses in a few days.
Mm-hmm.
And if everything continues to go as it seems that it is, I think we could probably go ahead and order the lenses. But let me just see you one more time with the lenses on. I always like to see existing lens wearers at least one time after we've done that initial fit.
That sounds good. I know we have an appointment. I think it's Thursday. I'll see you then for sure.
Very good. All right. Take care then.
Thank you. Bye.
Bye-bye.